Hello, I'm Chris Ruckel, U.S. Sales Manager for Cool Health, and I'm excited to share with you today our revolutionary new device, the TargetCool. The TargetCool is the first of its kind device that offers therapeutic precision cooling. As you can see represented in this diagram, we have ice listed on the top in purple. Ice takes a while to take effect and never gets to an ideal efficacious temperature. Represented on the bottom in orange is liquid nitrogen. As you can see, it's a very difficult gas to keep control of, and it never stays at an ideal temperature, which can actually lead to PIH or other complications. Shown in the middle in the blue is the TargetCool device. As you can see, it quickly gets to the ideal temperature and maintains that temperature throughout. Some device overview. What is TargetCool? TargetCool is a handheld 510K FDA cleared Class 2 medical device. It's approved in Korea and the US, and we offer distribution throughout Southeast Asia, the Middle East, and Europe. It's one easy-to-use system with 3 interchangeable modes. We offer the cooling mode, our boosting mode, and our freezing mode. TargetCool is indicated for the reduction of pain, swelling, inflammation, and hematoma caused by minor surgical procedures and aesthetic procedures. It's also indicated for surgical destruction of target tissue by applying cryogenic gases at extremely low temperature. There are no restrictions related to skin tone, and the device is safe for all Fitzpatrick skin types. The TargetCool weighs just 1 pound, so very lightweight, and each of its consumable cartridges will last around 3.5 minutes of continuous spray time. The device is easily charged with an included adapter charging cord and lasts for 10 hours on a full charge. Shown here are the TargetCool consumables. Each triangle consumable kit contains 10 guards, 10 cartridges, and 10 filters. Our boosting consumables come in packs of 10. Some science behind the device. Historically, CO2 has been uncontrolled, but with TargetCool, the CO2 is controlled before contacting the dermis, allowing the provider to have unique precision. TargetCool adjusts the thermodynamic state of CO2, changing the nature of the CO2 itself. This allows a user to control skin temperature by manually adjusting the distance and the timing of the cool jet. As a result, precise, rapid cooling is achieved. What is TargetCool cooling? The TargetCool has 2 infrared beams that intersect in front of the target area where the guard is located on the skin. The infrared sensors then provide a real-time temperature by reading the target area and automatically calculating the difference between the set cooling temperature and the target temperature. Based on the difference, a temperature feedback loop is created. The device constantly and precisely adjusts the thermodynamic state of the cryogen until the infrared sensor readings match the set cooling temperature. As a result, a rapid, precise, and reliable temperature is achieved at the target site. TargetCool is a form of cooling anesthesia. Cryotherapy likely works by reducing nerve transmission velocity in pain fibers. It may significantly reduce both motor and sensory nerve conduction velocity. Nerve conduction velocity is decreased at the site of cryotherapy application. This increases the pain threshold and the tolerance level. The pain threshold and tolerance is extended distally beyond the site of application. Shown here are 2 studies detailing the use of TargetCool for significant pain reduction for both steroid injections for acne as well as laser tattoo removal. How does TargetCool help minimize bruising? Its cold treatment causes blood vessels to constrict, reducing inflammation, bruising, and swelling. Illustrated here is the reduction of bruising and swelling with the use of the TargetCool versus BLT topical anesthetic for both HA lip filler and neurotoxin. The TargetCool cooling mode is a great adjunct therapy to HA lip and filler injections as well as PRP injections. What is TargetCool boosting mode? With a quick nozzle changeout of the device, you're able to fill a container with 3 mLs of any solution. It could be exosomes, skin boosters, serums, and spray those directly onto the skin at supersonic speed for ideal application, penetration, and efficacy. Providers can select from 4 container types. We have different sizes for each viscosity level. What is TargetCool freezing? The TargetCool freezing nozzle offers safe and effective cryosurgery treatment to remove abnormal or diseased tissues within the epidermis. It utilizes the CO2 gas at negative 79 degrees Celsius to safely and effectively get rid of moles, skin tags, warts, and skin lesions. Now Dr. Munavali will discuss using the TargetCool for cooling and boosting mode in a clinical setting.
Thank you. And my name is Dr. Gilly Munavali. I'm going to talk about TargetCool, our experience in our office with the boosting module, and specifically how it actually works. So TargetCool's boosting capacity consistently delivers various solutions through the dermal epidermal junction. This solution, in this case, is instantly cryo-frozen into a crystallized microparticle structure and delivered at an accelerated speed that is due to the presence of the pressure of the gas. The crystallized microparticles at this pressure can penetrate through the stratum corneum and accumulate right below the dermoepidermal junction, which is about 0.3 millimeters or 300 microns. And that is where the nerve endings, specifically the Pacinian corpuscles, are located. This type of delivery facilitates diffusion of the solution then into the deeper dermal layer and surrounding tissues to more completely provide anesthetic effect. This is some immunofluorescence showing this solution delivery, where here you have the usage of the TargetCool, the MTS, just after topical application and massage, TargetCool only, and then the TargetCool plus this boosting apparatus. And you can see the fluorescence in red accumulating in the upper reticular dermis. And again, that is where the vasculature and the nerve, the innervation of the skin is located. And by boosting in this way, we can achieve a clinical effect. And you can see here the solution, which penetrates, again, about 300 microns into the skin, does diffuse, according to the immunofluorescence here, over time, deeper into the dermis, providing even more of an anesthetic effect. And you can see that in the micrograph, the middle one on the right, which shows it going to 0.3 millimeters, 300 microns, and then below, even deeper, approximately to about 0.5 millimeters or 500 microns. In this small study with the graphical data shown on the left, you can see here how the fluorescence values that were calculated from this penetration for hyaluronic acid alone, and hyaluronic acid plus MTS plus the TargetCool device, and then hyaluronic acid plus the TargetCool itself. The third group showed a 165% increase in fluorescence transmission, which correlates to penetration and diffusion, compared to group 1, which is an untreated control group. Group 2 exhibited the highest fluorescent level of fluorescence transmission compared to the untreated control group. So in practical, clinical everyday, what we find utility for this, especially for pain control. So for example, during a typical Mohs clinic day in our practice, we implemented TargetCool to provide comfort for local anesthesia before needle sticks, before the initial stage and in between most stages. And here you can see an example of freezing an area after the first stage, before the second stage, in the area of of course, the nose, which is exquisitely sensitive to needle sticks and discomfort. And what we found just in a trial of 1 day of Mohs surgery in our practice using TargetCool resulted in a high degree of patient satisfaction in terms of reduction of needle stick pain, which I think is one of the most uncomfortable aspects of Mohs surgery. You can see a video showing the freezing of the surrounding area right before we put the needle stick in. Again, that's a 32 gauge needle, but the patient is actually smiling. They haven't felt much better.
No, nothing.
So
I feel pressure, but
words,
that's it.
and that is wonderful. That's exactly what we want, because it's a traumatic day enough for our patients, and with the surgery and reconstruction, the last thing they need is more discomfort with the needle stick. There are other intraoperative uses for TargetCool we found in our practice. Again, very helpful for modulation of discomfort. And because with the boosting module, you can put different solutions in there, we've chosen, or we attempted to use a lidocaine solution, 1% lidocaine with epinephrine in some of our procedures. And what you see depicted on the right is a treatment with the TargetCool boosting apparatus with lidocaine prior to utilization of fractional CO2 for acne scar resurfacing.
Yeah.
And here you see me using this for TargetCool for comfort for immediately post radiofrequency microneedling on the cheek, where the patient was experiencing some stinging and discomfort, which was immediately ameliorated by the TargetCool and penetration of that lidocaine right through the stratum corneum, which facilitated patient comfort post-operatively. That was for the cheek and the neck. So thank you very much for your attention. I'm going to turn the presentation back over. Thank you.
So in conclusion, why TargetCool? Well, it's tunable, it's customizable to each patient and treatment. It's the only device of its kind to offer precision cooling technology. It allows a user to control skin temperature, direction, location, and time. Its infrared technology allows the user to see and control the patient's skin temperature. And it offers rapid temporary pain management without the use of drugs. It alleviates patient discomfort. There's no waiting time for lidocaine to work, and the patients can offer feedback in real time. TargetCool not only benefits patients, but also your practice. For your practice, it avoids lengthy application times from topical numbing cream. It reduces cosmetic procedure downtime. It's a service that can be easily delegated to other staff members. It increases patient retention, and it increases practice revenue. For your patients, it offers a reduction of pain, swelling, inflammation, and hematoma from minor surgical and aesthetic procedures. It reduces anxiety and increases patient comfort, and it offers. In summary, TargetCool is the first and only tunable cooling device that senses the patient's skin temperature. It allows for optimal, precise cooling to alleviate discomfort before and after some cosmetic and aesthetic procedures. The revolutionary precision cooling technology doesn't damage the skin. Its infrared technology allows the user to control the direction, temperature, location, and duration. TargetCool may ease pain, swelling, inflammation, and hematoma caused by aesthetic treatments like neuromodulators, fillers, and PRP. And it's rapid, easy to use while providing a non-drug alternative to lidocaine. These are the reasons that many plastic surgeons, dermatologists, and med spas, as well as podiatrists, pediatricians, general practice physicians, and even dentists are utilizing the TargetCool today.